Hi everyone. In today's clip, I will talk a little bit about shingles. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Shingles is also known as herpes zoster, is a painful viral infection that causes a rash, typically appearing as a stripe of blisters on one side of the body or face. Shingles is caused by the varicella zoster virus or VZV, the same virus that causes chickenpox. After a person has had chickenpox, the virus doesn't leave the body. Instead, it lies dormant or inactive in nerve cells for years. Shingles happens when this dormant virus sort of reactivates. While the exact reason for reactivation isn't quite clear, several factors can increase the risk, including weakened immune system, conditions that compromise the immune system like HIV or AIDS, cancer like leukemia or lymphoma, and organ transplants. These are all can trigger the virus to reactivate. Also, immunosuppressive medications, drugs that suppress the immune system, like steroids or medications given after an organ transplant, can also increase the risk. Stress, illness, trauma, and radiotherapy can also be contributing factors. It's important to note that we cannot get shingles from someone who has shingles. However, if you have never had chickenpox or the chickenpox vax, you can contract VZV from someone with shingles through direct contact with the fluid from their blisters or by breathing in the particles from the blisters. Now, as per traditional medicine, there is no cure for shingles, but treatment aims to speed up healing, reduce pain, and prevent the complications, and early treatment is crucial for the best outcome. Common treatments are antiviral medications, which are most effective when started within 72 hours of the rash appearing. These medications are supposed to shorten the duration of rash, reduce the severity, and lower the risk of developing long-term nerve pain. The patients also are given over-the-counter pain relievers like acetaminophen, like Tylenol, or NSAIDs like ibuprofen, Advil, Motrin, or naproxen like Aleve to manage mild to moderate pain. For more severe pain, a doctor may prescribe stronger pain relievers, including opioids, tricyclic antidepressants, or anticonvulsants. So, numbing cream, gels, sprays, or patches containing lidocaine or capsaicin can also be applied to the skin to alleviate pain. Helpful home remedies for this include applying a cool wet cloth to the affected area to help soothe the discomfort, soothing baths and lotions, keeping the rash clean and dry, wearing loose-fitting clothing to minimize irritation to the rash. While most people recover from shingles within 4 weeks, some may experience persistent pain after the rash actually clears. As per orthomolecular medicine, shingles can be cleared up in a very safe, convenient, inexpensive, non-prescription way through vitamin C therapy. Vitamin C is an antiviral and antitoxin and inactivates the virus that causes shingles. This is how to go about this. And I'm telling this also from a first-hand experience. 3 years ago, I got shingles on the side of my face, on my head, and near the eyes, which can actually be dangerous as it might cause actually blindness, with, of course, severe nerve pain. If you look at my clips, actually, you will probably find the one that my face is somewhat puffed up and my head is semi-shaved. So you will know that's when I was going through it. I opted out of traditional therapy and I started taking 3,000 milligrams of vitamin C every 30 minutes. And I actually had my alarm set for this and continued until I had a single episode of loose stool, not quite diarrhea. If someone does not get loose stool after 15 hours of this dosage, they need to increase the vitamin C to 4,000 milligram every 30 minutes for every waking hours. So after seeing a loose bowel movement, you reduce the dosage by 1,000 milligram of vitamin C taken every hour. Then adjust the dosage of vitamin C downward to stay below the dosage that will cause loose stool, and adjust it upward to relieve shingles symptoms. You will continue the oral vitamin C therapy until the shingles disappear. It took me about 2 weeks to get rid of all the rashes, and then another week for the pain also to go away and disappear. It sounds too simple to be true, but it works in the majority of cases, including mine. So sometimes it's necessary to take vitamin C intravenously or IV for massive outbreaks. Much higher concentration of vitamin C in the blood can be achieved intravenously than by taking it orally. As early as 1950s, the medical literature reported that it was confirmed intravenous vitamin C curing shingles in 327 patients within 72 hours. Vitamin C blood serum levels of individuals fall during periods of high stress, and they develop subclinical scurvy, depleted vitamin C levels. This situation can set the stage for a shingles attack, and remember that the vitamin C acts as a drug, but the drug can never act as a vitamin. So with vitamin therapy at any given quantity, frequently divided doses are more effective than one large single dose. The reason one nutrient can cure so many different illnesses is because deficiency of one nutrient can cause many different illnesses. On the metaphysical side of and emotional side of things, stress is a major contributing factor, as well as childhood wounds that need attention. Bursts of emotions like anger or grief or strained relationship with ourselves can be seen as the root cause. Some specific emotional relationships to this ailment are: if it happens on the right side around the lower ribs, this is the location of the liver, and an outbreak here indicates suppressed anger that is trying to come up and out. It can be, if it is in the mid to lower back, this area is the location of the kidneys and adrenal glands. And an outbreak here indicates that you have been under a lot of stress and the body is struggling to manage the load. If it happens on the stomach or lower belly, an outbreak here indicates issues with digestion, both digesting information as well as digesting food. There may be some difficult information to process here, some trouble with integrating an experience or knowledge, as well as trouble letting things go. If it happens on the upper ribs, especially on the left side, if it happens near the heart, for example, this can indicate that a heartbreak, new or old, has been triggered. The ribs protect the heart, so this could indicate that something has broken through, affecting the energetic or emotional heart, and your body is trying to process that. The eyes, shingles near the eyes can indicate issues with seeing clearly. Perhaps you've seen something you didn't want to, or you want to see. So in either case. The forehead, this part of the body, is connected to thinking, rationality, and intuition. Sometimes issues in this region indicates overthinking, difficulty processing something intellectually, a challenging shift in the worldview, or an inability to fully access your intuition. Alternatively, a bubbling up around the forehead could be a call from spirit for your intuition to pay attention. If it happens the back side of the body represents issues from the past, what we've been trying to sort of put behind us. If shingles appear on the backside, you may doubly consider that there's an issue arising from the past that needs to be brought forward and dealt with. The front side of the body, especially the face, when we have visible wounds or illnesses on the front of our bodies, there is something troubling being seen or not being seen. Consider whether there is something you've been trying to hide, or if there is something you wish others could see or would see. Hope this has been helpful. Like and follow for more. Be the light.